Cognitive behavioral therapy, or CBT, is a type of psychotherapy that is used to treat a variety of mental health disorders. The goal of CBT is to help individuals identify and change negative patterns of thinking and behavior that can contribute to mental health problems. This therapy is widely used because it has been shown to be effective for many different types of mental health issues. In this video, we will discuss what CBT is, how it works, the types of CBT, the techniques used in CBT, and its uses. What is cognitive behavioral therapy? Cognitive behavioral therapy is a type of psychotherapy that helps individuals change negative patterns of thinking and behavior that can contribute to mental health problems. This therapy is based on the idea that negative patterns of thinking and behavior can be changed through the use of cognitive and behavioral techniques. CBT is a structured and goal-oriented therapy that typically involves 12 to 20 sessions. During these sessions, the therapist works with the individual to identify negative patterns of thinking and behavior and to develop strategies for changing them. How does cognitive behavioral therapy work? Cognitive behavioral therapy works by helping individuals change negative patterns of thinking and behavior. This is done through a variety of cognitive and behavioral techniques. Cognitive techniques focus on changing negative patterns of thinking, while behavioral techniques focus on changing negative patterns of behavior. The first step in CBT is to identify negative patterns of thinking and behavior. This is done through a variety of techniques, including self-monitoring, behavioral experiments, and thought diaries. Once negative patterns have been identified, the therapist works with the individual to develop strategies for changing them. The strategies used in CBT vary depending on the individual and the type of mental health issue being treated. However, some common techniques used in CBT include cognitive restructuring, exposure therapy, and behavioral activation. Types of cognitive behavioral therapy. There are several types of cognitive behavioral therapy, including traditional CBT, rational emotive behavior therapy, REBT, dialectical behavior therapy, DBT, and acceptance and commitment therapy, ACT. Each type of CBT has its own unique approach and techniques. Traditional CBT focuses on identifying negative patterns of thinking and behavior and developing strategies for changing them. This therapy is typically structured and goal-oriented, with a focus on changing specific behaviors. Rational emotive behavior therapy, or REBT, is a type of CBT that focuses on identifying and changing irrational beliefs. This therapy is based on the idea that irrational beliefs can lead to negative emotions and behaviors. Dialectical behavior therapy, or DBT, is a type of CBT that is used to treat individuals with borderline personality disorder. This therapy focuses on teaching individuals how to manage their emotions and develop healthy coping strategies. Acceptance and commitment therapy, or ACT, is a type of CBT that focuses on acceptance and mindfulness. This therapy teaches individuals how to accept negative thoughts and emotions and to live in the present moment. Techniques used in cognitive behavioral therapy. There are several techniques used in cognitive behavioral therapy. These techniques focus on changing negative patterns of thinking and behavior. Cognitive restructuring. Cognitive restructuring is a technique used in CBT that involves identifying negative patterns of thinking and replacing them with more positive and realistic ones. This technique is based on the idea that negative patterns of thinking can lead to negative emotions and behaviors. Cognitive restructuring can be done through journaling, challenging negative thoughts, and practicing positive self-talk. Exposure therapy. Exposure therapy is a technique used in CBT that involves gradually exposing individuals to the things that they fear or avoid. This technique can be used to treat anxiety disorders, phobias, and post-traumatic stress disorder, PTSD. Exposure therapy helps individuals learn to manage their anxiety and to confront their fears. Behavioral activation. Behavioral activation is a technique used in CBT that involves identifying and engaging in pleasurable and rewarding activities. This technique is often used to treat depression, as individuals with depression may have lost interest in activities they used to enjoy. Behavioral activation helps individuals to re-engage in activities and to increase their feelings of pleasure and satisfaction. Problem solving. Problem solving is a technique used in CBT that involves identifying problems and developing strategies for solving them. This technique is often used to help individuals with anxiety and depression, as these disorders can be accompanied by feelings of helplessness and hopelessness. Problem solving helps individuals feel more in control of their lives and can improve their mood and overall mental health. Relaxation techniques. Relaxation techniques, such as deep breathing, progressive muscle relaxation, and mindfulness, are often used in CBT to help individuals manage stress and anxiety. These techniques can also improve sleep and overall well-being. Uses of cognitive behavioral therapy. Cognitive behavioral therapy is used to treat a variety of mental health disorders, including anxiety disorders, depression, bipolar disorder, obsessive-compulsive disorder, OCD, post-traumatic stress disorder, PTSD, eating disorders, substance use disorders, borderline personality disorder, schizophrenia. CBT can also be used to treat physical health problems, such as chronic pain and insomnia. Cognitive behavioral therapy is a structured and goal-oriented therapy that is used to treat a variety of mental health disorders. This therapy is based on the idea that negative patterns of thinking and behavior can be changed through the use of cognitive and behavioral techniques. There are several types of CBT, each with its own unique approach and techniques. Common techniques used in CBT include cognitive restructuring, exposure therapy, behavioral activation, problem solving, and relaxation techniques. CBT is effective in treating many different types of mental health disorders and can also be used to treat physical health problems. Thank you for listening to this video.